Many parents find that swaddling their newborns can provide comfort for fussy infants and allow them to develop more settled sleep patterns. But did you know that swaddling the legs too tightly together can lead to a problem called hip dysplasia? The hip is a ball and socket joint. Normally, the ball or femoral head sits snugly inside the hip socket or acetabulum. In contrast, hip dysplasia occurs when the hip joint develops an abnormally shallow acetabulum that does not cover the femoral head sufficiently. This can cause instability of the hip and full dislocation of the hip joint. If left untreated, hip dysplasia may lead to difficulty with walking, hip pain, and early onset hip arthritis into adulthood. Up to 1 in 6 infants will show signs of hip laxity that can be an early indication of hip dysplasia. There are several non-modifiable risk factors for hip dysplasia, such as breech birth or breech position at any point in the 3rd trimester of pregnancy, a family history of hip dysplasia, female sex, and being a firstborn child. One modifiable risk factor for hip dysplasia is tight swaddling of an infant's legs straight together with the hips extended and adducted within the first 6 months of life. When the legs are swaddled tightly together, the femoral head is aimed up and out of the acetabulum, preventing adequate contact between the two parts of the hip joint for proper hip development. This position increases the risk of hip dysplasia and hip dislocation. To promote normal hip development, an infant's hips should be swaddled in a flexed and abducted position with the knees flexed. This position aims the femoral head deeper into the acetabulum for sufficient contact between the two parts of the hip joint, promoting proper hip development. There are many safe ways to swaddle infants by using blankets or commercial products designed for swaddling. We will demonstrate several techniques here. Begin with top corner of blanket folded over, one hand to midline. Bottom corner up and tuck to chest or back. Second hand to midline. Tuck edge behind baby. Ensure arms and legs are contained, but movement is not restricted. Begin with top edge of blanket in line with shoulders. One hand to midline. Tuck corner behind back. Second hand to midline and tuck corner. Fold bottom edge loosely up to abdomen. Tuck both bottom corners behind back. Ensure hips can flex and extend, so movement is not restricted. Remember, swaddling is a useful practice for soothing infants. When swaddling, always remember to wrap the legs loosely, allowing an infant's hips and knees free to flex and move.